Hi, this is the final of 6 oral histories by East San Diego County physicians. The Hoffman Society and the San Diego County Medical Society Foundation thank all the physicians for their participation in the oral histories and, most importantly, for their contributions to our community.
So Brendan Daly had a dilation of the coronary artery 2 or 3 days ago, so he wasn't able to join us today. I'm going to take the opportunity to kind of ramble on how I got to Grossmont. My great-grandfather was born in Scotland, my grandfather was born in Canada, and he legally immigrated to Cleveland, Ohio. He attended Western Reserve Medical College and practiced in Cleveland, Ohio for a few years until he was stricken with rheumatic heart disease. He had to give up practice at the time. He heard of the salubrious climate in San Diego, and in 1906 moved his family to San Diego, and sure enough, after a few years he was able to resume practice. I was born in the Mercy Hospital. The attending physician was a Dr. Martha Welkton. It was spelled W-E-L, not W-H-E-L. She was active in the Medical Society. At one time, she was the Medical Society's representative to the, or delegate rather, to the National AMA Convention. She was also at one time a president, or vice president rather, of the Medical Women's National Association Incorporated. One of their goals was to establish a medical school that was administered, staffed, and attended by women only. So she lived to be 80, but really never realized that ambition. However, if you think about the trends we're seeing today, I think it won't be too long till a lot of medical schools are going to kind of follow that pattern. I transferred up to UC Berkeley, and that helped me get into the School of Medicine at UC San Francisco. There are 5 members out of our class of 72 who ended up in San Diego. Kathy Carson and Jim McDaniels practiced downtown, and Ken Hansen, Roy Vondermaiden, and I ended up in La Mesa. Another interesting sidelight, recently when President Obama stopped teasing the birthers and had his birth certificate made public, one of my classmates was the attending physician. Dave Sinclair, however, never he had died several years ago and never knew that he had delivered a future president of the United States. So after medical school, I did a rotating internship at San Francisco Hospital. On the first day, we had an orientation meeting, and the administrator told us that it was a lot easier to get an intern than it was a good telephone operator. That kind of set the tone for the year. After the internship, the Korean armistice had been signed, but doctors were still eligible for the draft until they were 40 years old. So I decided to volunteer for the Navy for a couple of years. I remember filling out a form saying, "Where would you like to be stationed?" And I said, "Hawaii, Japan, Germany," and they sent me to San Diego. So after I did 2 years in San Diego, then I went to work for Dr. Roy Ledford and Roger Eisenhower. They paid me $1,000 a month. I had to buy my own malpractice policy, which cost me $240. I was driving all over town making night calls for him, but the gasoline was only 30 cents a gallon then. So after I'd spent 2 years with Ledford and Eisenhower, I moved to La Mesa and entered practice with my then brother-in-law, Roy Vondermaiden. We had an office at the corner of Lake Murray and Jackson Drive. The owner of the building was Carl Sturkow. I don't know what troubles Carl had, but he was always a satisfactory landlord. And we also bought Christmas trees from him in his Christmas tree farm. A gift from a grateful patient. And seeing that gold watch made me think, well, it must be pretty nice to be a doctor if people give you gold watches. But I never got a gold watch given to me. I remember somebody gave me a sack full of lobsters one time. Another family used to give me a gallon of red wine every year, which was really terrible wine.
There you go, red.
Well, after several years, I kind of got restless, and I entered the surgical program down at the county hospital then. I can't remember exactly when the university arrived, but somewhere along the line, Dr. Orloff arrived. He brought several junior residents, but he kept on the more senior ones till we finished. We had a really good grounding in vascular surgery. Gordon Sproul, Jerry Pinto, Howard Kirtland, and Bob Dreamer were excellent instructors, and looking at the output of other programs, I think we had as good a program as anything on the West Coast. Anyway, at the end of my residency, I had planned to go into practice with Dr. Ivan Baranovsky, but he had just been called to be Chief of Surgery at the Hahnemann Medical College. So I was very happy when Bob Hyman and Marvin James consented to take me on. That was really probably one of the best things that happened to me in my life. It was a great group to work with. About 2 years after I joined, Dick Gilman and Bob Dreamer were getting a divorce, and we asked Bob Dreamer to come out. The issuing of a contract for emergency room physicians. Up until then, it had been kind of catch can. But John West group got the contract, and I was strongly in favor of that because I knew there were a lot of surgeons. Haynes Shepard and Rod Sorensen were also members of that group.
My name's Paul Epler, and I'm sorry Brendan isn't here because this will be a monologue about anesthesia in East County. But anyway, I graduated from the University of Iowa Medical School in 1957, and I took my rotating internship in Fresno County Hospital. The University of Iowa was pretty well known because the chief of anesthesia there was Stuart Cullen, who was nationally known. Anyway, after my spring of my internship, I decided I was interested in anesthesia, and so I wrote letters to a program in New York, a program in Sayre, Pennsylvania, and also to the San Francisco General Hospital program. I received a letter, and the chief up there said, "Come on up and visit." So I had one of my weekends off. I went to San Francisco, and they said, "Well, the chief's gone. He left and he went to San Diego. His name was Ray Ponak." So I never did meet Ray until I actually came to San Diego to practice. But my residency was started at the San Francisco General Hospital, and at that time it was the anesthesia department was run by the Stanford Medical School. That was in 1958. There were two surgical services. There was UC and Stanford. And as I remember, UC would have their surgeries, say, Tuesday and Thursday, and Stanford maybe Monday and Wednesday or something like that. And ironically enough, Bob Dreamer was one of the chief residents of, I think it was UC at that time. As far as monitoring goes, it was very primitive because we measured blood pressure with a cuff, and we got so we put a precordial stethoscope right here over the trachea so we could hear the patient's heart and hear the breathing. And also Dr. Cullen, the second year, I'm digressing a little bit, but the second year Stanford moved to Palo Alto. Yes, Norm Shumway was there at the Stanford Lane Hospital as kind of the secondary thoracic cardiac surgeon. And I remember he had his own heart-lung machine, and there was a veterinarian that ran the machine for him. But when I got over to UC, halothane was just coming into use. And that made anesthesia a lot easier than to try to titrate Demerol and nitrous and oxygen. As I remember, even when I came to San Diego, we didn't do EKGs very often. Well, I came to San Diego because of Gil Kenyon. He and Don Dose had trained with Stuart Cullen in Iowa, and Gil came up one Saturday for a meeting, and I was looking for a place to practice, and he invited me down here to visit the anesthesia service. Anesthesia service had a policy for all of the anesthesiologists to get hospital privileges for almost every hospital in town. So we work in almost all the hospitals, at least for a short time, so we were familiar and could help out if somebody needed some help. Well, I came to Grossmont eventually when John Clayton took a long voyage to the Marquesian Islands, and so he was going to be gone about 3 months, and I had a chance to come over and fill in for him, and I was glad to leave Verado at that time because the caseload was really more active at Grossmont, and it was a stimulating place to work. We would have we had a clinic where the patients would come in the afternoon before surgery. They'd have their blood drawn, their lab done, and then we would meet with them. Most of the anesthesiologists, some didn't, but I always felt it was a point of honor to try to see the patient before surgery. I remember one woman, this woman wanted to see the baby come out, and so they rigged up a mirror, so she's lying on her back. This wasn't Ernie Shaw's daughter-in-law, it was somebody else. Anyway, she lay on her back, and she could see when they pulled the baby out of the uterus, and she wrote me a letter, and she said, "Oh, I appreciated that so much. It was almost a spiritual experience."
This is a matter of history. I'd like to mention when I was an intern in 1947, we used chloroform, and that was a great anesthetic. But I understand you never use it anymore.
One time, Dr. Cohen let me do open drop chloroform. It was just kind of a stunt to say I'd done it once. But it certainly doesn't take very much. And there was, of course, danger of liver damage. So most of the anesthetic machines were fixed for ether. And then it was easy to switch over to halothane. And
when I was in the Navy, we were living in an apartment up in Claremont, and I used to moonlight by taking night calls for a GP up there. So one night I was to take the calls, and I wasn't feeling very well. I had a little fever, and I got a call from a woman who had a temperature of 104, and she was feeling terrible. And I thought, well, she's probably got the same thing I have. It won't hurt. I'll go over and check her out. And I did, and told her to take aspirin and call the regular doctor in the morning if she wasn't well. The next morning, though, I got up, looked in the mirror, and my face was covered with little vesicles. I had chicken pox. So I called this lady and told her that I'd exposed her to chicken pox, and she said that was okay. They didn't have children, and she had already had chicken pox. Well, it seemed that she was related to, or her husband related to a disc jockey called Happy Hair. So a day or so later, I'm listening to Happy Hair while I'm still at home. He's on the radio saying, "I have discovered the most wonderful doctor. He not only makes house calls, but he brings his own diseases."
What a great presentation. Thank them all.